We equate kidney stone pain to something that would be extremely painful. And the way we tell men that how the kidney stone pain sort of feels like is almost equivalent to natural childbirth. So when women are trying to deliver a baby and they have no analgesics whatsoever, just completely natural, no epidural, no pain medicine, it's extremely painful. Kidney stone feels sort of like that. But when you ask women that have had natural childbirth, what does the kidney stone feel like when they pass it? They say the kidney stone is worse. So kidney stones are basically like little crystals that form in your kidneys, in your upper urinary system. And these crystals come together and form like little rocks in your urine. And they have multiple different varieties of types of stones. People form them for different reasons. And our real goal is to find out why you're forming those types of stones and how to best manage them. About 8% of the US population have kidney stones. It's very prevalent in men and women, and now we see a lot of it in children as well. For smaller stones, you're able to pass them on your own, and we sometimes will offer some medications to try and help you pass the stone. But if you have a larger stone that gets stuck, or a big stone in your kidney, you may require some sort of intervention. Kidney stones, patients usually present with flank pain, so they have pain in their flank region, and that pain can radiate down to their groin or their pelvis region as the stone starts to move from the kidney down to the bladder region where you're trying to pass the stone. So with that pain comes nausea, vomiting. Quite often people will see blood in the urine or have burning with urination. What we really get concerned about is when patients have a fever associated with those stones, because we're concerned about infections. And when you have persistent nausea and vomiting or really severe pain, that quite often requires an emergency room visit, which then requires us to intervene in some way or get you hospitalized to help manage those symptoms. So there are three main surgeries for kidney stones. The first treatment option that a lot of people will choose from is called shockwave lithotripsy. It's become less popular nowadays, but it's still a very viable treatment option. And it's basically sound waves from outside of your body to try and crack the stone into smaller pieces so you can pass the little pieces on your own. Second treatment option is ureteroscopy. It's probably the most common procedure we do for stones nowadays. And that's basically taking a small scope and going through your urinary tract with no incisions to break up the stones with lasers and pull out little particles with little basket devices or grasping devices. And then finally, the third one is percutaneous nephrostolithotomy or percutaneous nephrolithotomy. It's basically a long word that means that we make a small hole in your kidney, about a 1 centimeter incision into your kidney, and then we break up the stones and remove all the particles. There are a lot of predisposing factors to people that make kidney stones. Fluid intake and dietary things are definitely up there, especially people on high protein types diets. But if you have a family history of stones, you're more prone to having kidney stones. High animal protein diets are very prone to making stones. So patients that do these sometimes fad diets or diets that are very high in protein need to modify those types of diets if they're making stones over and over again. And those ones tend to make uric acid or calcium oxalate stones. Salt is very contributory to stones as well, so we try and lower your salt intake. And then there are foods that are high in oxalate. So if you have a very healthy diet, quite often you have foods that are high in oxalate. But high oxalate containing foods are healthy foods. It's just that if you have an excessive amount of those types of foods, we try and limit or modify it so that you have a moderation of those types of foods. Are things like spinach, beets, rhubarb, sweet potatoes, nuts, tofu, soy products, chocolate, things like that are very high in oxalate, and we do have to reduce some of those if you're very high in those in your diet. Dietary calcium, so foods that are high in calcium, make you less prone to making stones. And supplements like calcium supplements and tablets and pills and even things like Tums can sometimes make you more prone to making stones. So we like dietary calcium and we try and limit supplemental calcium unless it's absolutely necessary. Over time, and when I came to Columbia, we've developed a comprehensive kidney stone center. So we have a team of urologists that can do kidney stone surgeries of all types. So we individualize your treatment. Some people that have the exact same size stone will choose different types of approaches on how to treat it, and we can offer all those different approaches here. We have a nutritionist, we have a nephrologist that specializes in kidney stones, we have endocrine people that specialize in bone metabolism, and a lot of these things interact with each other. So really getting to a specialty place like Columbia will help you prevent making kidney stones, but also treat the other conditions at the same time that make you prone to making stones.